Why are you so devoted? Or so driven almost?
You know, when you see people, as we saw in the early phase of the epidemic, being hit by something so devastating as this was at the time, continues to be, but it was particularly devastating in the 80s. It's very difficult to walk away from it. And since research was my thing, and I was interested in clinical research, this was the biggest challenge of the day. And so stepping up to the plate was only natural.
Is there still a stigma? Is stigma still a problem?
Oh, yes.
Here?
Everywhere.
In Canada?
Everywhere. You know, I experience stigma. It changes and evolves, but I experience it all the time. I mean, let's be clear. We just ended 10 years of denial from our federal government in any matter related to HIV or populations most affected.
What was the problem before? Why?
Well, I'll put it in simple terms. When Tony Clement was the Minister of Health, you probably remember that was 2006 when I actually gave a speech at the Toronto International Conference proposing for the first time that treatment, if widespread, could lead to the stop of the morbidity, mortality, and transmission that ultimately became treatment and prevention. I discussed that with Tony Clement. He was not interested. And when I talked to his assistants, they told me, Julio, the problem is you're persona non grata. You're viewed as somebody that promotes the behaviors that are at the root of HIV transmission, because you support men who have sex with men, you support commercial sex work, you support intravenous drug users. Nothing could be further from the truth. What we're trying to do is embrace people where they are, whoever they are, whenever they're ready to embrace with us, so that we can work with them to improve health outcomes for their benefit and the benefit of society at large. But that's a lesson that was lost in the previous administration, largely because they had difficulty with the populations that are most affected.
We read headlines or stories now suggesting that the war against AIDS is over. Has it been won?
Let's be realistic. We're not even halfway there. There are lots of challenges. There are challenges because there are countries that criminalize drug use, they criminalize sex work, they criminalize homosexuality. So how do I envision bring a strategy that requires engagement of these very populations in an environment where these individuals are stigmatized, persecuted? It's happening everywhere, even in Canada. Canada has the dubious record of having the largest number of individuals being prosecuted because of exposure to HIV. Let me repeat that. Having exposed somebody to HIV in the context of consensual relationships, and despite the fact even they could be HIV undetectable and no transmission has occurred.
So they're not contagious, but they can go to jail for knowingly having sex with someone.
Assault, correct.
It's aggravated assault.
Right.
And the maximum penalty is
10 years. And you have a.
But is that wrong? Like, what if somebody knows that they have HIV and they don't tell you when you're having activities?
Now you're pushing me. Eh? We're in the CBC. Look, if anybody goes out tonight with somebody else and they have consensual sex, both people are supposed to know what risks they are taking. It's not appropriate to blame a priori the party that is infected with HIV, particularly if the party is undetectable and we know it's not going to transmit. We now have randomized controlled trials that show that if I am HIV positive, I'm taking medication, I'm virtually 0% likely to transmit.
The other interesting change over the years is this PrEP, Truvada, this new drug, or new to Canada, has been approved this year.
Correct.
What do you think of that? It's seen as prevention.
Of course. You know, we're in the early days of PrEP, and it has been recognized that it can be of value for individuals to take one pill once a day during a season of risk, however you define that. And these individuals can get very high levels of protection, somewhere in the neighborhood of 80 to 90% protection if they take the pills regularly.
PrEP can be expensive. It can be $1,000 a month.
With current drugs, it is. We're hoping that when generic drugs get into the play, we're going to have a much more favorable cost. That's right.
So the argument's being made now that it's so helpful that it should be made available to all. I think only Quebec now puts it on the provincial plan.
Quebec
should
is,
it be covered by the general public?
Yes, of course. I think
For
it should.
anybody who wants it?
Well, that's the issue. This is not about who wants it, it's who would be better suited to take that medication. What we're saying is we need to be smart. If we're going to ask the taxpayer to pay for it, we need to define programmatically where are we going to get the best return on the investment. So
and that's who people who are maybe exposed to a real risk.
Of course. So what we're saying
not
is,
just people who want to have extra.
Right. For example, the fact that you are an homosexual man doesn't mean that you necessarily need Truvada. You would have to be involved with an HIV positive person, or have multiple partners who you don't know their status, or having had sexually transmitted diseases in the last year that indicate that you are at high risk of acquiring HIV.
There's now spikes among women, and among some Indigenous groups. What are you worried about? Where is it not improving?
In Canada, we still have a problem. There are pockets of serious concern. Saskatchewan has been in the news because there is a bad situation with regards to HIV there, but Manitoba also has significant problems. And
why Saskatchewan, Manitoba?
We all have problems across the country because the epidemic among First Nations, unfortunately, is not under control. And so, you know, our First Nations are desperately asking for repairs for a lot of things, historical damages and the like, and this is part of it. And so we need to find a way to work together to stop this epidemic in every community across the country, including First Nations.
You've been at this so long. Are you happy? Are you satisfied? Or are you still banging your head against the wall?
Well, a bit of all of the above. I mean, I'm incredibly proud of the progress that we have made. I'm incredibly proud of the work that we have done with the United Nations to bring a strategy to the world. I mean, sure, we're proud of that. But at the same time, why does it take so long to do the right thing? Why do I have to talk to so many people so many times? And oftentimes you get the cold shoulder. Yes, Dr. Montaner, this is important, but I have other priorities. Look, this is life-saving and cost-averting. It doesn't get any better. What else do you need? So it's a bit frustrating at times.
So you're going to stop and give up?
No. No, I want to see it through. I think, I think we have a plan, and I consider myself blessed to have had the opportunity to be part of developing this strategy, but I want to see it to the end.
Well, that's a remarkable body of work. Thank you so much.
Thank you. Thank you.
Doctor.